Sorry about your father.
I'm not. Are we done emoting now?
If there's anything I can do, just...
You know, you're right. I don't think I can sleep alone tonight. You can tell me that that is liquid Vicodin.
We're giving IG shots to everyone who came in contact with your patient. Shockingly, none of the nurses volunteered to administer yours. It goes better in a large muscle. Drop your pants.
You know, I usually pay tens of dollars to hear that.
Funeral's tomorrow.
My mom called you?
There is a 3:40 flight out of Newark. And if you leave now, you can be in Lexington tonight. Your mother wants you to deliver a eulogy.
Eulogy. From the Greek for good word. If she'd asked me to deliver a bastardogy, I'd be happy to...
Then be a grown-up. Call your mother back and tell her that you're sick with grief, but you're too busy to be there.
She knows when I'm lying.
Then start writing.
I am not doing this because I care.
Cuddy drugged me. My mom didn't call Cuddy. She called you. I knew you couldn't stay away. I knew you loved me too much.
I'm doing this for your mom.
I'm not doing this at all. If there was something to be done, I would have done it in the year he spent dying. You took my Vicodin? I'm in pain. One? So the Vicodin is my leash. One will take the edge off, but it won't give me enough relief for an escape back to Plainsboro. Kane.
The restroom's right there. You can make it on your own.
I suppose I could talk about the summer he decided he wasn't speaking to me. 2 months, not one word. Anything he wanted to say, he typed up and slipped under my bedroom door.
You don't want to say anything? Don't say anything, but go. Tell your mom you're sad for her.
Just by being there, I'd be lying.
She wants to think, for a moment, that she had a happy family. So give her a gift. Lie.
Give me my cane. I'll go to the damn funeral. I said I'd go to the funeral. I didn't say when. You actually keep a flashlight that doesn't need batteries in the trunk. Next to the jacket, emergency water, nail clippers, toothbrush, space blanket.
When things go wrong, I like to be ready. Will you please hold the flashlight for a minute? You know, those aren't just my car keys. My house keys are on there, too. Amber gave me that keychain.
No, she didn't. Not unless your pet name for her was Balbo. A man who would lie about a gift from a dead girlfriend
Is probably responding to a childish, pointless act of petulance.
The struggle to resist one's captors is never pointless. Vive la résistance.
Well, I hate to break it to you, Che, but simple delay won't work. Your mother will hold the funeral till we get there.
Your father was a punctual man, beholden to time. 2 minutes late for dinner, you didn't eat. My mother would never disrespect him by starting the funeral late.
Yeah, you clearly have no issues to work through.
Come on, forget the keys. Call a locksmith. We'll go inside and play Guess That Smell with the truckers while we're waiting. Join me on the dark side.
Dark side's done, House. I'm delivering you to your mother, and that's it. I've moved on. Good heavens, we haven't missed it after all. It's like the end of a Christmas Carol.
I'm so glad you're here. Oh, it's a load off of my mind just to see you. Thank you, James.
Mom, how could you delay the funeral?
Honey, your dad is dead. He's not going to care. Do you know what you're going to say?
I don't know. Just let the minister, one of his buddies from the Corps.
You're talking. I don't care that you didn't like him. He was your father, and he loved you. The war is over, Greg. Please do this for me. Stop looking so worried. I know he's gonna make me proud.
I'm sure you know him better than I do.
It means more to me than I can say to have all of you here today. And now, our son, Gregory, would like to say a few words. Greg?
There's a lot of people here today, including some from the Corps. And I noticed that every one of them is either my father's rank or higher. And that doesn't surprise me. Because if the test of a man is how he treats those he has power over, it was a test my father failed. This man you're eager to pay homage to, he was incapable of admitting any point of view but his own. He punished failure, and he did not accept anything less than. He loved doing what he did. He saw his work as some kind of sacred calling, more important than any personal relationship. Maybe if he'd been a better father, I'd be a better son. But I am what I am because of him, for better or for worse. And I just wish. Put it back. Well, he's not gonna miss it.
I'm done enabling. You can't even let them put him in the ground without making it serve your agenda.
You really want to do this in front of everybody? You want to punish me or them?
You also need to prepare President Dabala's case for this week's Morbidity and Mortality Conference.
Oh, unfortunately, I'm overdue a mani-pedi appointment.
Not you. Foreman's department.
Oh, right. Well, he's got all the time in the world.
We made the wrong call. He died. There's nothing to present.
But obviously garnered a lot of curiosity.
And we don't have more important things to do than satisfy everyone's idle curiosity?
It's not idle. The question of how we deal with two possible diagnoses whose treatments are contraindicated is worth discussing.
Just keep it clean. Simple. We did a test that called into question our initial diagnosis, so we changed our mind.
And if they ask how the test was done?
Why would they do that? It's a routine lab test.
Routine lab tests don't involve blood you stole from a corpse to trick me into giving the guy the wrong treatment.
Yes, and if you brought that up, it'd certainly make for a lively debate about the morality of murdering murderers. But since you burned the only evidence of that...
To cover for you, not me.
You're protected. The decision was a coin flip. There was no right or wrong answer. The body's underground, 8,000 miles away. Nobody can prove anything.
That room would be filled not because of a coin flip, not because of the patient, but because House's department screwed up. They're gonna be like sharks in a chum-filled swimming pool. And there's no way I'm jumping in unless I'm in a steel cage.
So what do you want?
I want to know you have everything covered.
Got what covered?
We're just reviewing the Dabala case, making sure we didn't miss anything.
We didn't. Except, of course, the thing that killed him.
We've got a problem. When Cameron sent Dabala's blood to the lab, she specifically asked for the anti-centromere antibodies test.
So?
The printout they sent you included just the anti-centromere antibodies, but the lab also did a full blood panel.
So I'm not an idiot. I obviously made sure the cadaver I got the sample from had the same blood type.
You apparently didn't check his cholesterol.
How far off?
20%.
Dabala didn't die of high cholesterol. Why would anyone even bother to compare the two reports?
The same reason I did, because they're looking for anything we might have screwed up.
We could claim the blood analyzer broke.
We can't. Cameron documented that it was perfectly calibrated when she did the test.
So the numbers are off. It's weird. Who cares? If it comes up, just act surprised like it's some irrelevant curiosity.
Can't do this. I can't go in there and stack lie upon lie. We've got to figure out a way to explain this.
There's obviously something wrong, and I'm not even saying we need to talk about it right now. I just don't see why you have to deny it.
I'm not.
Now you're denying you're denying.
No, I'm denying that there's anything to deny.
Robert, you can't do this. You can't hide things from me.
There's a problem with the Dabala M&M. The HDL numbers on one of his early blood panels don't match a later panel.
That's weird.
Yeah. It's no big deal. Cholesterol didn't have anything to do with his death, but, you know, after being let go from Mercy and then that thing with 13's drug trial, Foreman's paranoid about people questioning the way he handled the case.
Well, that's ridiculous. If anything, Foreman should be feeling secure. He's the one who had the right diagnosis. We're the ones who talked him out of it.
I know. Don't tell him I told you. He doesn't want to show any signs of weakness, especially now that House is claiming he wants him to stay in charge.
All right.
I gave him statins.
What?
If they ask about the cholesterol, just say I prescribed a statin and forgot to put it in the chart.
You want to solve a problem in the records by creating another problem in the records.
There's one problem with the records. There's a problem with my record keeping. There's no way anyone can prove me wrong.
How'd you get access to the statins? You gonna get someone in the pharmacy to confess to yet another record-keeping problem?
I saw an open cart, just took it.
Why would you steal a drug you can just as easily ask for?
Because I'm trying to get you off the hook.
A story that raises more questions than it answers only puts the hook deeper down my throat. It's all right. I'll handle it.
How?
By telling the truth. The truth is, I don't have the time, I'm not in the mood, and I don't see the point.
You don't want to do the M&M because you're not in the mood.
This kid is dying, and I've got House trying to push all his responsibilities onto me.
They're not his responsibilities, they're yours. You're the one who wanted to be in charge.
I wanted to be in charge, not a figurehead.
Then do the M&M, it's all yours.
But you want me to get flogged for what? So you can have an academic debate about a diagnostic dilemma no one's ever gonna face again?
the hell's going on here?
I just don't want to do the M&M. At work? Not even close.
All right, great.
We need to talk.
Unless it's life or death, it's gonna have to wait.
It's about Dybala.
Let me rephrase, unless it's a current life.
Foreman can't present the case at the M&M.
I know you guys are busy, but he's just gonna have to suck it up and make the time.
It's not the time.
Then what is it?
The anti-centromere antibodies test, the test that causes to change treatment from blastomycosis to scleroderma. It wasn't.
Wasn't what?
Dr. Cuddy, they need you in the pediatric ICU.
Who's they?
I don't know, but I think they're lawyers.
If you guys screwed something up, just come clean. It's not gonna be that bad.
Where'd you find it?
Find what?
Niacin-bound chromium supplements. It was right on top of the file. You don't know about it?
No, been here all night.
One of Dybala's previous docs was prescribing ultra-high doses of niacin-bound chromium to boost his HDL.
So?
So it gives us something to point to. We can explain the wide variation between the HDL numbers. We're safe. We're covered. You really didn't request the info?
No. And obviously you didn't either. Which means...
How'd you find it?
Fat old black guy. Knew he had to be taking something for his cholesterol.
And what now?
I'm not the boss.
You don't think I should be fired?
Why? That will ever be treating a genocidal dictator again. Better a murder than a misdiagnosis.
Whether you want to be in charge or not, you are. And you always will be.
A 75-year-old African man presented to our hospital following a rapid onset of hemolysis. He'd been fine prior to onset. Chest pain, fever, coughing, and chills. He does note a 9-hour plane flight.
Thanks, Jim.
All right, let's see how many more turkeys we can miss. Yeah, this'll work.
What the hell? God, sorry, I don't know what happened. I can't move my arm. Am I having a stroke?
I don't know.
The self-important jerk does not have transverse myelitis. He's got cancer.
How do you even...
Okay. Maybe I paid the redhead down in records a few bucks to CC me on all your cases. A few patients die, you might get sad again. Make a speech that would end your career. Frankly, I'm stalking you for you.
Did you look past the first page of the file? No AML cells anywhere. I did the blood smears myself.
Still cancer. You know how I know? He's got an oncologist for a doctor.
And your magical leukemia detector is more powerful than a flow cytometer?
I look for zebras because other doctors rule out all the horses. In this case, you are those other doctors. You haven't earned a zebra. $100.
Are you serious?
Look, friends don't diagnose friends with cancer. I get it. Your problem is you're not objective. Your caring is clouding your diagnosis. You just cut that out, and you can be a pretty decent doctor.
So when will he be able to move his arm again?
Should be soon. Started smoking again?
No.
What does that mean? Is it bad that he's coughing?
Hi, Dad.
Hey.
Alyssa, hey. I didn't know you were coming.
I was at Mom's house when Dr. Wilson called.
I can go if it's gonna be weird.
No, stay. It's fine.
Hi.
How are you?
Is he okay?
Yeah, he's okay. Not a big fan of this coughing, though.
You must be Ashley. Hi. Hey, are you okay? Do you think this cold sore thing could have caused this?
No. Whatever's causing this is affecting more than his nerves. I need a crash cart in here! Actually, if Aspergillus fungus balls took root in his lungs and spread to his spine, it would explain both. Thanks. The treatment involves riddling the infected area with BB-sized pellets of antifungal meds.
I assume you don't just load up the 12 gauge and pepper me with birdshot.
No, we have a slightly more humane delivery system, but we do have to open you up. It is surgery, and like any operation, there are risks.
Wilson, he's got global lung damage. Means it's not fungal. It's PCP pneumonia.
Obviously, something is knocking out his immune system. 3 options: HIV, acquired SCID, or my personal favorite, cancer. I'm sure you will test for all 3.
You have acute lymphoblastic leukemia, ALL.
So, it is a recurrence.
No, it's different. It's a second leukemia, probably caused by the chemotherapy we gave him 5 years ago.
That's why you didn't see it. Maybe they can rename it ironic leukemia.
This is not the end. Tests show that the cancer is limited to your brain. That's good news.
How can cancer in his head be good news?
The blood-brain barrier separates the blood in your head from the blood in your body. Keeps the cancer bottled up. We can go for a cure.
So give me the numbers. What are we looking at?
90% chance of cure.
Really? What if we're in the 10%?
Steady decline, but 6 months of a good quality life.
Does he have to go through another bone marrow transplant?
No. Chemotherapy. We can go at this with drugs alone.
When do we get started?
We begin by surgically planting a shunt so we can get the drugs directly into your brain. I already booked the OR.
You're the only one who can make cancer sound like good news.
We get it out of your head and you walk out of here. Paralysis gone and cancer-free. Move your fingers. The chemo's not working.
Does that mean it's not cancer?
No, it means the chemo from your first round of treatment has made the leukemia resistant.
So I'm in the 10% that don't get cured.
Maybe not.
We just removed a screw from the guy's lung. And the weird thing is he didn't get better. Any idea what that means?
It means you're not listening to me.
No, it means I'm ignoring you to make a point. There's a difference.
The problem with that technique is I have no idea what point you're making.
That your idea is implicitly not worth responding to. Doubling your patient's chemo dose is stupid. Damn, now it's explicit.
It could swamp out the resistance of the cancer
The
cells.
fact that it theoretically should work doesn't make it any less stupid.
Of course it does. It's exactly what you would do.
I'm me, you're you.
And a table is a table.
And chemo is poison. And double chemo is double poison. And I can handle it when things go wrong. You can't. And things could go very, very wrong.
I can handle it.
Look.
I can move them. What is it, Jim?
A I'm gonna need to run some tests. The cancer's gone, but over half his hepatocytes are dead.
In only 24 hours?
He needs a new liver.
Well, look on the bright side. You can publish the results of this case study. No one will ever double the dose again.
If I don't find you a new liver, you've only got about 24 hours left.
So what do we do now?
Your father's been moved to the top of the transplant list, but all we really can do is wait.
That's it? We wait? Tell me something that I can do.
I'm sorry, Mel. You and Emily don't match Tuck's blood type, and neither does Ashley. So a live liver donation is out. The best thing to do is just what you've been doing. Be together.
Hope he already told you that you're gonna die. Because it's gonna make what I'm about to say a lot more relevant.
House, I know it's raining out there in the hallway, but
I was just in the ER, testing my patient for autonomic dysfunction. It's the only department with a shower big enough for the whole team, plus the cardiac monitors, plus me. Anyway, relevant part. Just wheeling the guy out, trauma came in. Motorcycle versus semi.
how bad?
Bad for the motorcycle, good for your liver. Blood type's a match.
Why wasn't I paged?
Because there was a problem. No organ donor card. Dead guy's sister is next of kin. She's refusing to allow the donation.
Where is she?
20 minutes away.
It's not fair, Jim. You just helped me get my family back together. I'm not ready. I would have had 6 more months with them if you hadn't given me that extra chemo. Now I have less than 1 day.
I'm sorry. We knew the risks.
I don't want to lose them again. I can't lose them again.
There's nothing more we can do.
5 years ago, when I needed a transfusion, you used your own blood. We have the same type, which means you can give me a part of your liver.
I'm your doctor.
You're my friend. Should I die because you're also my doctor?
Of course not.
Fine, then. You're fired. Now you're just my friend. Now you can do what's right.
Tucker, I can't. I want to donate a lobe of my liver to Tucker.
That's insane.
I'm donating a small portion of...
You have hundreds of patients.
And until I run out of excess organs, why shouldn't I do everything I can to help them?
Because you're a doctor, not a donor.
Why did you make me the head of oncology?
Not because you have the most organs. You're thoughtful, caring.
Yeah, caring. By your own criteria, a strength and not a weakness.
This is coming out of guilt.
This is coming out of friendship. I have a friend who's about to die, and I have the opportunity to save his life.
Okay.
You're bleeding through your bandage.
Good morning.
Don't we need to get you to a doctor?
I am a doctor. That didn't come up last night.
We didn't do a lot of talking.
I'm good.
You never told me what caused your accident.
I was stabbed by a patient. That'll teach me to overbill.
If she likes crippled guys, I'm free for the next 6 minutes.
What do you want?
45-year-old truck driver. Recurrent seizures, no metabolic or structural.
Does this look like a good time?
Sort of. At least as good as the other 12 times that I've called and paid you in the last 3 weeks.
Those times, I just didn't feel like talking to you. Kind of like now.
I'd apologize again, but I'm still waiting for you to accept the first one. You do work for me. I am entitled to ask when you're coming back.
I don't know when I'm coming back. I don't know if I'm coming back. You got a problem with that? Fire me.
It's good to see you in the hospital as a patient, if not as a doctor.
Believe me, rather be the guy with the clipboard.
How you doing?
Arrhythmias are gone. Fine motor control's improving.
Not what I meant. If you need to talk to someone, a professional,
I'm fine.
fine enough to get back to work? You don't have to work for House, but you do owe me 20 clinic hours.
Getting nice doesn't buy me an extension?
Buys you whatever you need. But I know you. If all you do is physical therapy and your nighttime version of it, you'll lose your mind faster than you regain those fine motor skills.
I have this terrible pain in my left shoulder. It came out of nowhere.
And nothing seems to help.
Any other symptoms? Chest pain? Lightheadedness?
No, none at all.
What were you doing when the pain came on?
Just sitting and praying.
She'd been helping to make the altar breads that morning, but no hard physical work or repetitive motion.
A couple of possibilities. You have enlarged lymph nodes, so I'd like to start by ruling out breast cancer. And I do mean rule out. It's probably nothing. I'm going to do a quick breast exam. Do you mind stepping up for a moment?
Not at all.
That was so I could ask about the second possibility. Left-sided pain means it could be angina, which is made worse by stress. Might not be a coincidence that the pain started on the verge of a major life change.
How did you know?
Blue veil means you're a postulant. Haven't taken your vows yet. Brown vestments means you're Carmelites, cloistered nuns, which explains the chaperone. You're about to withdraw from the world for good. I was a seminarian.
Who obviously didn't take his vows.
Cussack made my ass look fat. Do you mind unbuttoning your shirt and lying down for me?
I have had second thoughts. I'm kind of a wreck.
A life of perpetual enclosure and almost complete silence. If you weren't wrestling with this, I'd say there's something really wrong with you. I'm going to admit you. There's a little mass here and I'd like to get it checked out.
It's just a benign fat deposit. Her imaging's clean.
Stress test too. It's not angina. So why the shoulder pain?
Is it possible that she hurt her shoulder?
Thanks a lot.
I didn't tell him.
You were cagey about where you were going. Chase has been cagey in general. Good chance I'd find the two of you in the same cage. So I'd park, follow you.
How you feeling?
Better. Her drum's healing nicely.
Good to see you on your feet.
Patient's a nun? Were you turning back to your long-abandoned faith in time of trouble?
She was next up in the clinic, and I don't want your help.
You got stabbed. You blame me. But what did you learn about me that you hadn't known for years.
Maybe I was an idiot before and I'm not one now.
Maybe the reverse is true.
Thanks for all your help.
Your soul sister is having a fungal infection from the unprocessed wheat in the altar breads. Explains the shoulder pain and the jumbo lymph nodes. Thanks for all my help.
We almost done here.
Assuming you did this shaving your forehead. Okay then, I'm ordering a head CT.
No, I don't have a headache. I'm not dizzy. Eddie, I gotta get back.
You gotta stay here. We'll straighten out that mess with Marco tomorrow. Let the doc do his job.
Actually, stitching you up is really the ER doc's job.
Yeah. Too long of a wait.
Yeah, also a lot of cops in the ER. Not that you care about that. So how did this happen? Yeah, you're right. It's a stupid question. The answer is kind of obvious. Those scrapes on your hands means you didn't try to break your fall, means either out cold or totally disoriented when you went down. No sign of trauma other than the cut means no one hit you in the head. Powder burn on your jacket sleeve means someone shot a gun.
All right, Eddie. Come on, let's go.
I don't care what you guys are into. If you don't get this checked out, it'll happen again.
What will?
This. Cool. 32-year-old man recently developed loud noise-induced vertigo. CT was clean, no internal bleeding, no edema. Everything else is in the file. Cameron, get your hair in the divorce.
This guy strained his back 3 years ago, and that's it. All the rest of these pages are blank.
Yes, he won't tell us anything. Understandable, since he's a drug dealer.
So he's dangerous and withholding, which you find irresistible. But guys like that, they never call.
He actually said he was a drug dealer?
Not out loud, but he was wearing a solid gold Patek Philippe. His friend had a Rolex, but their phones were prepaid burners. They could toss them as soon as they're done.
It doesn't matter if this guy's a drug dealer or not. Noise-induced vertigo means ear or brain. Head CT was clean, so I'm thinking acoustic neuroma. We need to do an ABR to test his hearing.
Acoustic neuroma fits. So does lidocaine toxicity, or benzocaine. Depends what he's cutting the coke with.
So now he's not just a drug dealer, he's a cocaine dealer.
He seemed peppy. You test his ears, I'm gonna go test his cocaine.
You think this guy's just gonna hand over a briefcase full of illegal drugs because you ask nicely?
I hope not.
You're gonna hear a series of clicks and hisses. Sensors measure electronic activity to your auditory nerve.
How long is this gonna take?
An hour, maybe an hour and a half. Or you could walk away with a tumor in your ear. Guy's probably late to his stabbing.
Impedances look good. Starting at 13 clicks per second at 50 decibels. Check this out.
13's middle name is Beauregard? Wave-free latency is 3.8.
Slightly delayed, but nothing significant. That's what sticks out to you? House is clearly screwing with us. It's a fake pay stub.
Looks real to me.
There's no way she makes that much money.
I make that much money. And apparently you don't. Pupils are constricted. Pulse is bounding.
The airway's clear. Need a crash cart in here.
Gotta be his blood pressure. We need to get it down before he strokes out.
At least we know his ears are okay.
Put the patient on vasodilators, got his hypertension under control.
He got worse here at the hospital, means thug life probably isn't what's making him sick.
Which means we can stop the Bloodhound Gang routine and go back to being doctors.
But we're doctors all the time. It's so boring. Fine.
Could be sick sinus syndrome.
No chest pain, shortness of breath, brain aneurysm secondary to polycystic kidney disease.
Normal urinalysis, kidneys impalpable. Is that a new watch?
Thought I'd give myself a little treat. What if it's not his brain, but it's on the way to his brain? Carotid stenosis.
Get an ultrasound of his carotids. See if his arteries are clogged.
Ultrasound showed no narrowing or obstruction in the patient's carotid.
Not that he's worried, keeps asking when he can leave.
You bugged his room?
Our patient sleeps in the building where they keep their stash. Eventually, he'll say something and gives away where that is. And we'll find out what's making him sick.
But we ruled out environmental causes.
You ruled out environmental causes.
And you pretended to agree just so we take him out of his room so you could plant the bug.
Carotid stenosis was a decent idea. But an even decenter idea is that he's got toxins stored in his fat cells. Every calorie he burns makes him sicker.
If we're going with toxic exposure, we should just start testing for the most likely suspects.
Bug's a better idea than blindly running tests for days.
Tell him it'll take weeks. It'll be faster.
What do you mean, weeks?
These tests take time. There are a lot of possibilities.
No, but I can't sit here this long. I got things I gotta take care of.
You're worried about all the poor school children going without their drugs? I'm sure someone...
I want to be discharged.
I'll get the forms.
His friend brought him in 15 minutes ago. Temps 105, pulse is weak and thready.
He's not making any sense.
It's too much money, Eddie. It wasn't the deal. It wasn't the deal.
Is he gonna be okay?
Eddie!
We gave him antipyretics and soft steroids to reduce the fever and prevent organ damage. He's no longer delirious.
Patient went out, came back worse than before. Points us back to environmental, tied to wherever he went.
No, it doesn't. Where's Foreman?
He had a meeting with Cuddy.
What do you mean, no, it doesn't? We screwed up the tail. My car was impounded.
True, amusing, and irrelevant.
You're off environmental?
Wherever he went, it wasn't for long enough. Add in the fever, and infection's way more likely. And if it is an infection, his symptoms suggest it's moved to his brain. Which means...
to a lumbar puncture. It's not an infection, but it might be an autonomic nerve disorder.
The hair's still bumping me. Did you get it cut because you're ready for the next chapter, or...?
Stuck a needle into his spinal bodies twice. His heart rate stayed normal. If we add that to his other symptoms.
That would be a mistake. You're a wuss.
See, that one I'm better.
Are you gonna beat me up? It sounds stressful. Maybe you should pop one of your beta blockers first.
You have a heart problem?
Medically, no. He would have told us about that. Metaphorically,
It's an effect from operating outside of the law. You know, sometimes I have to do bad things, and not always to bad people. The last few months, that hasn't been so easy. You know, a guy got me the pills, and they control the stress. Look, don't say anything to Eddie, all right? The last thing I need is the guys thinking that I've gone soft.
when was your last pill before we originally admitted you?
The night before.
And we stuck you in here and you went into beta blocker withdrawal. That's what caused the hypertension. When we got out of here, he took another pill and the hypertension went away. Which means it was never a symptom. We take that off the table, we've got vertigo, fever.
Stress. He's been in this game for a while. Either he grew a conscience over the last few months or he's producing excess adrenaline.
Pheochromocytoma.
What?
It's Greek for you'll be back doing bad things to good people in no time. MRI is adrenal glands. You're okay with that, right? You're not gonna put a pillow over his face.
My son is not huffing Freon.
Mr. Arnold, Dr. House is like a savant when it comes to diagnostics.
What's his genius theory? Because Kenny's not normal? He's doing drugs to deal with his pain?
Maybe the way to look at this is that you are normal.
And what's that supposed to mean?
You're like any other parent who thinks his kid can't be doing drugs.
Doing this because my dad thinks I'm on drugs?
I was doing drugs behind my parents' back at your age, and I had a lot less reason to be. Not that your life must be miserable. But not that I am suggesting that you should be doing drugs. How's school going?
I'm homeschooled.
Really? You're lucky. Going to school was boring.
My dad took me out, and it wasn't because it was boring.
I had a rough time in school, too. Maybe not like you, but, you know, I don't mean to compare our situations. Actually, I guess I am comparing our situations, but only to show you how yours is worse. You can edit that out, right? So I don't look like an idiot.
Relax. Everyone acts like an idiot around me. Makes you think it's not an act. Can I have something for my headache?
Yeah, is that new?
16 years old. It's the same birthday I do.
I'm gonna start the test now. Study showed no signs of scarring in Kenny's heart.
It wasn't drugs.
Well, then give me something better. What's causing heart block?
It could be toxoplasmosis. We should do an LP to test for infection.
If it was toxoplasmosis, we'd have seen enlarged lymphs. And because you're not pretty enough to be an idiot, you must know that already, which means you just said it because you want to do an LP to look for intracranial pressure.
Because it is intracranial pressure.
Wait, I'm not done. You thought I wouldn't catch on, which means either you think I'm an idiot, which is flattering. I'm doing my hair differently.
The kid's got headaches. He's been popping acetaminophen like peanuts.
How could you possibly think that I was done? I prefaced that with an either. It needs an or. Or you are an idiot, which is possible. I'm not great at judging men's looks.
The OR?
And the MRI room.
Yes. Dr. House frequently conducts differential diagnoses in a variety of places. He feels that a change in venue often leads to a change in thinking processes. I have to go take care of something else.
Just let me do a CT scan, see if I'm right. The sooner we fix the problem, the sooner we can get to his reconstructive surgery.
Who cares if you're dead? It's how you look. Well, since you've given me nothing better, we're back to drugs.
The one thing we know it's not.
Decreased uptake on the membranous septum.
Could be an artifact. We can redo it, but
Nothing's nothing. Do an EP study.
EP study means we have to stop this kid's heart.
I'll set it up.
House. You have a minute to be disemboweled?
I'm going to thread this catheter through different areas in your heart, and once I found the right pathway, I'll apply some electrical energy.
It'll stop my heart?
It sounds worse than it is. You'll be fine.
Is it gonna hurt?
There'll be some discomfort. If you've done drugs, I understand. Being different's really hard. Kenny, it's more important for you to get better than to worry about getting in trouble.
If I did drugs, that could explain my heart problem?
It could.
And then you can do the surgery to fix my face?
That's why we're here.
You know how famous people, everywhere they go, people are watching them, staring? They never have a chance to just be. You know? And a lot of them turn to drugs. People stare at them because they're beautiful, but me, they just stare.
You okay? I need to know what kind of drugs, Kenny, and how much.
Coke. Mostly a lot of coke. And then when I run out, I usually go to LSD or acid.
Those are the same thing.
They are?
You don't do drugs, do you?
I drank from my dad's liquor cabinet.
We're not going to do this test.
No.
I need you to turn on your side. We need to intubate. I need some help in here.
No tumors in the patient's stomach, so...
The scope caused varicose bleeding. Took 20 minutes of banding to stop it.
Todd was right about the liver failure.
Yeah.
His craniofacial deformity is causing intracranial pressure, which is causing...
Where are the nosebleeds? Where's the labored breathing? You're right about me being wrong. You're wrong about you being right. I need new ideas. Anybody? Does it bother you that this kid's gonna die because you won't put down that camera at all, you know?
You people should be extra motivated. I'm sure they all want to look good in the film.
No, because now they're too worried about looking bad.
Dr. House, heart block plus liver failure could mean autoimmune, maybe scleroderma.
Forming? Does that make sense?
Not without tight skin on the hands, muscle weakness, and a 30-year-old patient.
Liver failure plus heart block could be a mitochondrial disorder.
Hey, see what she just said.
Liver failure plus heart block could be a mitochondrial disorder.
Go look for signs of retinal degeneration.
No, it's ICP. You're only going to see swelling.
Take him with you so he can see the degeneration too.
lean forward and place your chin on the rest.
I can't reach it.
Scooch in a little.
I'll take care of it.
Just like last time?
Maybe we should try this the old-fashioned way, Okay, look up to the ceiling and try not to blink, okay? Okay, good. Now straight ahead. There it is. Swelling, no degeneration. It's not mitochondrial. Swelling proves there's increased pressure in his brain.
Absolutely.
So now we can schedule the reconstruction.
Absolutely not.
Your test proved you wrong. We found exactly what I predicted we'd find.
Swelling means there's increased pressure. You get a gold star of David for proving, yes, this kid has a big head and big heads cause pressure. It doesn't explain the liver.
Too much acetaminophen does.
JRA explains all of it, including the liver. One theory is better than two. Treat with steroids.
If you're wrong, steroids are gonna mess with his immune system, put off his surgery for months.
You really want to lose this argument in front of the camera?
I'll speak to the father. Dr. House believes that Kenny has JRA, juvenile rheumatoid arthritis. We need to start administering steroids.
Will the steroids fix it?
I don't think he has JRA. I think Dr. House is wrong, and that the steroid treatment could be dangerous. I think I can get House thrown off the case and get Kenny the facial surgery he needs.
Didn't think you had the guts to stage a coup.
Coup failed. Scheduled for execution at dawn.
No, you're not.
No reprieve from the governor.
You're a test result away from becoming House's front runner. He doesn't care about what you said or what you did 5 minutes ago. He just wants the next good idea. Show me 20% magnification of the forebrain.
I look at our patient. As soon as I saw his face, I saw a regular kid. One thing about being a plastic surgeon, you don't see what is, see what could be.
Talk like that around House. Doesn't matter how many good ideas you come up with.
Wow, you are ugly.
Wow, you're an ass. I have a deformity.
I know. That's why you're ugly. But you're a lucky boy. Anywhere else in the animal kingdom, your parents would have eaten you at birth. Your son needs steroids. Dr. Cuddy agrees.
Does Dr. Taub?
He's not a real doctor. He's a plastic surgeon. All he cares is that your son looks good in his coffin.
So I'm supposed to believe you? A doctor who cares?
You shouldn't care if I care.
I don't trust you.
Because I don't think the surgery's important. You're putting your trust in someone who does think the surgery's important. You're willing to take chances, to risk his life for something he doesn't need.
I do need it. I can't have real relationships. I can't even have a real conversation. Not even with my dad. Dad, I know you love me. But you don't treat me normal. You're always protective. The world can always go to hell. But you never yell at me. Even when I screw up. I want to be normal.
Take your steroids, and you get to live. And you can do your surgery. And it'll only change your face. It won't change who your face made you.
What?
Are you wearing my tie?
Oh, I saw it in your closet, and it happened to match my shirt.
Why were you in my closet?
Looking for a tie? What's the big deal?
Obviously, he wants you out of the closet for some reason. I suspect marriage, but I'm liberal that way. Now, tell me how someone can have an allergic reaction when all of their tests were negative for known allergens.
Environmental. File says he's a real estate developer. Could have been exposed to something visiting a construction site.
He's lying.
He's not an executive. I saw his hands. They're covered with calluses and little cuts. He works with them a lot.
Stand up.
Oh.
Our little girl is finally growing up. You dream of this day when it finally happens. So what did Mr. Meathook say when you called him a liar?
I didn't.
Baby steps. Go down there and do it.
But what if I'm wrong? I'll just end up offending him.
Consider that part of bonus. All right, I'll send along one of your big brothers to help. You want scary, smarmy, or shorty?
We need to ask you a few questions. Alone, if you don't mind. They tend to be personal in nature.
Well, I'm his wife. I can probably answer them better than he can.
They're about his job.
Well, what does that matter? He sits in an office all day.
Honey, take a break. It's okay.
No, seriously. If there's something really wrong with him, I want to know about it.
It's not.
My questions are about what he eats for lunch at work and what comes out at the end. Bowel movements, mostly. Color, texture, smell.
Okay.
Pretty sure you can't help with that.
Maybe I could use a break. Thank you for your honesty.
You're welcome.
I can't let my wife find out about this. You have to promise me.
That depends on if it's considered.
We promise.
I lost everything because of the recession. My entire real estate company. And she has no idea.
So what do you do for a living now?
I used to be a janitor when I was in college, and now I'm almost 40 and doing it for the people I built homes for.
Why?
Why do you think? Because I need the money.
No, I mean, why lie to your wife about it?
None of our business, really. What kind of cleaning?
Industrial jobs. Crime scene cleanup, septic tank repair, mold removal. It's physically killing me.
We used cooling blankets to get his temperature down. He stabilized at 102.
Problem's not boric acid. We found no traces of it on his skin.
Infection from the murder victim's blood?
Autopsy report was negative for communicable disease. Cause of death was an overly stabby girlfriend.
We found Vicodin in his office.
Give it to me. Might look like Vicodin, but be something else. It's real. Unfortunately. Because Vicodin doesn't cause rash, fever, and joint pain. It does make Taub considerably less annoying, though.
Maybe we're thinking too far outside the box here. Just because he could have picked up any one of 100 exotic diseases from his job doesn't mean he did.
Taub's life partner has a point. Started treatment with antibiotics and got worse. Simple answer begins with M, ends with Mia.
Meningococcemia?
That works, too. Confirmed with a lumbar puncture. On the off chance we're wrong, find out what else he's been lying about besides his job and his drug use.
He's getting worse. He can barely move his legs.
I can't feel them. I can't feel my feet.
What is it? What is happening to him?
Luckily, he didn't lose his feet.
We were able to restore his circulation before any serious damage set in.
It's not meningococcemia. CSF was negative for bacteria.
But high on lymphocytes. It's some kind of viral infection.
Serum sickness fits everything.
It'd have to be a cause, some drug he's been exposed to.
In rare cases, a tick or a spider bite could set it off.
Show of hands. Who's going to this charity thing Friday night?
Or you got a date?
Cuddy is getting an award. I think we should all be there. Show our support.
I assume you're planning on screwing it up, so you want to maximize witnesses.
Why does everyone go to that?
Experience?
Shut up. How about go or work the clinic all weekend? I hear it's Genital Herpes Awareness Month. Serum sickness fits. Take him off the antibiotics, start him on corticosteroids. If we're right, he'll be better by morning.
He locked himself inside. He went crazy. He hit me.
Bert? Open the door, Bert.
Bert! Talk to us!
Bert?
Open the door, Bert!
Both his kidneys are fried.
He's in a coma. He has maybe a few days left.
We could try and get him on the transplant list, but in his condition and without diagnosis, I don't see him getting selected.
He wouldn't survive the surgery.
Hence my previous comment.
What do you want us to do, House?
If it's a tumor, we start chemo. Bombard his head with radiation.
Which will probably kill him in this state.
And without an MRI, we don't even know if he has one.
He's definitely dead if we do nothing. If I'm wrong, all we do is shave a few hours off.
We'll need his wife's consent.
Masters will get it.
Probably not a good idea.
He's right.
No, he's not. Consider this me officially booting you out of the nest. Why rash again? It went away, needs a reason to come back. We know it's not an allergic reaction, so we must have done something to set it off again. What?
We put him on dialysis.
Move him to the ICU.
We also did a partial MRI.
2 hours before the rash came back. They're not connected.
What was he doing 2 hours before he broke out the first time?
Cleaning a crime scene.
Crime scene and an MRI. Still not seeing the connection.
Missing connections this entire case. Did he say anything? Did he show any signs of stress in the MRI room?
He said he was cold, but it's always freezing in there.
Cold and rash.
Cold urticaria causes rash, but it's almost instantaneous, not time delayed.
And it wouldn't explain his other symptoms.
That's what we did. We made him cold. CAPS. Genetic disorder caused by a mutation in the cold-induced autoinflammatory syndrome 1 gene.
Muckle-Wells syndrome? It's only been a couple thousand documented cases in the U.S.
Well, now there's a couple of 1,001. Fits every symptom there. We're idiots for not seeing it before. Treat with rilonacept. He'll live a long and healthy life filled with lies to his wife and future child.
I'd call you now to tell you I'm thinking of you. But it does me no good when the phone is just blocking my view. And I would sail back to you. I would sail back to you. And I would come back and admit that it wasn't your fault.